Do you know what thermography is used for in wound management? We'll tell you. Thermography is a non-invasive way to measure skin temperature and represent body heat in an image. It is carried out using infrared thermal cameras, and with them we can obtain images. The principle of this technique is based on the fact that living beings emit a high amount of infrared radiation due to body heat. This infrared radiation is measured by thermal cameras. Andreu, a nurse and author of the website Curas y Heridas, tells us how he uses the thermophiles in clinical practice.
Now, technology is a tool that we can include in our clinical practice, as it allows us to perform an assessment at the vascular level, at the wound level, for example, to assess or evaluate a burn, chronic venous insufficiency, if there is a risk of ischemia or an ischemia, neuropathy, deep injury, and ultimately it can give us a lot more information. Through a photograph, which is a quick, painless, and also non-invasive for the patient. And in this case, we use this camera, which is this tiny one. It has two sensors. It has the optical sensor and below the thermographic sensor, which is responsible for detecting and collecting information. The action of interest is taught to us through a thermic machine or a thermogram. In this thermogram, what we see is all the temperature information detected by the camera, and it shows it to us through a color palette, which is normally a rainbow palette that goes from very low temperatures with a more bluish color and high temperatures in a more red color. This allows us, for example, in this case, to detect ischemia in this patient. When taking it in the cabin and performing an evaluation of the intra hemorrhage, we saw that one of the feet or one of the extremities was colder than the other. We saw this right away. It can be seen very quickly, and then we did other tests to determine the degree of this error. Yeah, a vascular alteration was detected, and it was confirmed that there indeed was a hyriocinema of ischemia, and treatment could be started. In this other case, for example, it is a diabetic patient, and conversely, the other patient where we see is an increase in temperature in the distal area of the limb. And this is due to ischemic neuropathy, a diabetic neuropathy. Yes, what happened in this case is that due to a reaction in the stomach, in the armadistal zone of DL, that is, the arteriovenous chums were open for longer than necessary. And that's why if the air's temperature was also rising, at the same time, more blood irrigation. Other utilities that we take from it is to make an assessment of a study at a vascular level, especially at a level of PT to enter. And without more details, I don't know when to finish. Doctors who have calluses and see if there are possibilities in the sense of the lips in case of having, or we can prescribe, like in this other case, some incompetent perforators. We saw in the photograph that the area was significantly higher internally. The patient had a quite significant increase in temperature. We interpreted that it could possibly have a competition at the level of perforators, which was then effectively confirmed by ultrasound. It was confirmed to be in competition, and the treatment could be returned. It's an example, so you can also see that quickly through an image that doesn't take even 10 minutes. Well, we had to detect or imply that there was an alteration there that had not been seen until now, and we were able to refer the patient for quick treatment.
Wait for me, I'm not too far behind. I know I can change.